how do you change your like the therapy you do versus when you're doing somebody like Peds or like a teenager who is like super athletic versus like an 80-year-old who like
Yeah, I might
dropped their
just
hip or
add a
something?
tad to the question. Like,
Okay.
do you focus more on like necessarily the amount of weight they're using or the amount of resistance, or do the overall exercises and things
I,
change more than
Yeah.
the
I
weights?
focus on form more than anything.
Definitely.
But okay, so if you go for peds, that's completely different than an 80-year-old.
Yeah.
I mean, if you're going really young peds, you're trying to get those hit those developmental milestones: walking, skipping, running, jumping. Because usually when you're seeing a pediatric patient, they're probably missing something along that line. Now, if you're seeing like a sports injury for like a 13-year-old, 14-year-old kid, that's different than just seeing like the normal pediatric setting. So if I got, I don't know, 16-year-old baseball player versus 80-year-old grandma. 16-year-old baseball player who messed a shoulder up, his throwing shoulder, versus 80-year-old grandma who has torn rotator cuff. Way different treatments. Exercise is pretty similar if they're both rotator cuff injuries. I mean, you go based on EMG studies and all the data to find out, okay, which muscle, how do we strengthen that muscle most efficiently. But for the baseball player, you got a longer rehab. You got to get them back to first range. Both of them, you got to get range of motion. Okay. You don't have to have surgery if you have a torn rotator cuff, unless it's a complete tear. You have a complete torn supraspinatus, you got this little thing going on. But if it's a grade 2, they can still get it up there. What you'll see is they'll do this thing. You strengthen all the others and help get that range. Pain's still your guide. Okay? Still want pain-free range of motion first before you get anything else. But the end game's different, if that makes sense. So you'll see, the grandma till you can get her functional. I mean, that's your goal. Can she do everything in her daily life that she wants to be able to do? Baseball player, you need to go beyond that. Okay, so you get them to the functional part, but then you got to get them back to throwing. So you initiate like Thrower's 10 program or any other strengthening program that you want. You initiate a throwing program as well. So you don't just take, 14-year-old and say, okay, go throw. You got to start slow and work on form. And you also got to build up the leg strength with him. You got to build up his throwing form. Because there's a reason he hurt his shoulder in the first place. Unless it was like a traumatic, slide in the first and a dislocation. So you got to take a thorough history, and that kind of guides you to what you need to get. That's what I would say. History is the most important but most overlooked thing in physical therapy.